Welcome to the CurePSP webinar series. CurePSP's mission is to provide education and support for people and their families affected by PSP, CBD, MSA, and related brain diseases while funding research towards a cure and prevention. Webinars are made possible by the generosity of donors and other supporters. My name is Bruce Ginelli, and I am the Director of Communications and Marketing at CurePSP. The topic of our webinar today is Care for the Caregiver, Difficult Conversations. Questions for our speaker will be accepted at the end of the presentation. At that time, a chat box will appear at the bottom of your screen where you'll be able to type and submit any questions you may have. We will field as many questions as time allows. At this time, it is my pleasure to introduce our speaker today, Valerie Sanchez. Valerie has worked in the medical social work field since her internship at University Hospital in San Antonio, Texas. Over the course of 17 years, she worked in adult medical surgical areas to include the emergency department, rehabilitation, inpatient psychiatry, and outpatient psychiatry. With a move to Dallas in 1994, she began working in hospice first as a social worker and then as a bereavement coordinator. Currently, she provides the clinical supervision for the social work staff and oversees the Bereavement Integrated Therapies Department for Faith Presbyterian Hospice. Over the past 18 years in hospice, she has provided workshops and grief support groups as well as individual family and children grief counseling. In 2008, she completed the requirements for certification in thanatology through the Association of Death Education and Counseling. Valerie?
Bruce, good afternoon. Thank you for that wonderful introduction. I wanted to start off by saying that a lot of the work that I have done is with families, starting off with acute illnesses, something that was repairable or treatable, or with a surgery or medication that they could find, if you will, a cure. And also working with families to discover what was wrong, what was the name or the diagnosis of what the many symptoms they were experiencing was called. And then how long do I have in some instances? So my work has been with folks who come into hospitals and find that there's something wrong. It is treated and they go home, as well as working with folks who may not have that opportunity because they keep trying to find what is wrong and keep coming back into hospitals. It seemed like a natural kind of course then after a time to move into working in hospice with those folks who then had their diagnosis go from a chronic progressive illness to something that was end of life. So a lot of what I talk about today will kind of cover all those different places, and then you can find where you're at in all of that journey, I guess, in your medical care and treatment. Our medical technology has grown even just in the last 10 years. Our ability to test and diagnose and then to treat is phenomenal now. We're able to do things we've never been able to do before and to understand a lot more of what we hadn't been able to do before. And so we get a strong sense that there's really no illness maybe or sickness that medical science and technology cannot cure or save. And I think that at times that puts the medical community kind of at a disadvantage. Because when we're faced with an illness or something that we don't know or is not well known, or maybe the treatment is unclear, our world can be turned upside down because we spend an awful lot of time looking to those folks, those physicians and therapists and clinicians for answers. So our focus, our task becomes to educate ourselves about the disease and the disease process, to understand what those symptoms are, and to develop our medical team to find out who those folks are that are going to help us, and also to find resources in our community and also resources in our family to make plans for what comes next. And I think it's really important to remember that Everything that is done in this world is done by hope. We cannot lose that part of us, that hope. So, who is caring for you? Who are you caring for? We identify each other by our titles, if you will, or mother, father, sister, brother, husband, wife, son, daughter, even friend or best friend. Those are our titles. But what are our roles? Beyond the title, what role do you play in this relationship? And what I mean by that is, what are the things that I do in this relationship, in this family? Because this is about families. It's about our relationships to each other in that family. So who's the banker? The cook? The housekeeper? The peacemaker? Who's the peacekeeper? Who's the nurturer or the disciplinarian? We have titles and roles in our families, and we expect each other to perform those. We don't even think about it. We don't even discuss it sometimes. We just grow into those. You know who you are and what you do. Families have their own dynamics, their own rules, and we have those silent and unspoken rules as well. So what's normal in your family is really what's normal for you. I know that sounds a bit like a commercial, but it's true. We are attached to each other in very unique ways. So our families are our own, and they are normal for us. I find it really hard to look for and find, I don't think I've found a quote-unquote normal family, but I have found families who have, through relationship, through their times together, through asking and having these difficult conversations, have found ways to heal a lot of the things that they are going through emotionally, physically, and spiritually. So, in our relationships to one another, we know who we are and what we do. Who are the historians? Who are the talkers? Who are the criers? My mother once told me that I was the crier, that I cried too much, that there was no one on her side of the family that cried. It must have come from my father's side. Like your eye color, a genetic thing, your crying was part of all of that. And she said this to me as I had just walked into her hospital room. I'd just come in from the airport. She was just diagnosed with breast cancer at the age of 55. And I knew right then, listening to her, that our roles were about to change drastically and dramatically. It's about our attachments. When we're given a diagnosis of a chronic or a progressive illness, our world as we know it changes profoundly. Our bodies change, our relationships change, and we react to those changes. Our reactions to these changes, if you will, to the loss of our health, the impending loss of our independence, all of those things that we kind of know we have to go through but aren't sure exactly what they are, all of those reactions come to us. We have physical reactions, emotional reactions, psychological reactions, and spiritual reactions. All of those are very normal, the reactions that we experience. Emotionally, we might experience some fear or anger or maybe some guilt. Physically, we might eat too much, sleep too much, or not enough, or sleep or eat too much. There might be some tension that we're feeling. I know oftentimes people who are struggling with different illnesses or treatments will do a lot of heavy sighing, not really knowing why. So it's important to look at what all these reactions are to the loss of that health or to the change in our situation. Also spiritually, people have reactions to this diagnosis or prognosis. Spiritual distress is a disruption of one's belief or value system. It affects the person's entire being. Some of those signs of those can be anger at God or a higher power, or questioning what the meaning of life is, or having a sense of emptiness. All these reactions happen when our world is turned upside down, when this diagnosis or this thing that is now affecting us physically comes into our life. It's like our snow globe, our world is turned completely upside down and shaken and tipped over. So how do we tip it back up? How do we find the answers? Where do we begin those conversations? Well, the first steps, put my head together and I thought what we need to do is look for and educate information about the disease. Educate ourselves about that. Understand what our symptoms are. Develop a medical care team. And that might be something that's related to, at least in our family, finding our insurance provider and then going with their recommendations. Finding specialists, finding those people in the medical community that understand our particular diagnosis. Finding resources in the community, things like home health providers, sitter services, identifying our caregivers, not just our family, but the ones in the community, our church members, our church community, our neighbors, that's our community. But even before we get to these first steps, we've just been given this information. We have to take a breath. We have to find, in the midst of all of that chaos, where do we start? A Sufi proverb goes like this: when the heart weeps for what it is lost, the spirit laughs for what it is found. But first, we weep. We have to allow for all those reactions to work through us and our family, because our family, we are connected, we are attached, will also feel those things. If we take these tasks, they may be taken up all at once. While educating and understanding and developing our team, our family dynamics may be shaken. So we have to practice what Ira Byock, who is a physician in palliative medicine, calls some life-affirming phrases. These are: please forgive me. I forgive you. He talks about the 4 things that matter most in a book about living, and his work with folks who have been in emergency rooms, in hospices, and he talks about how they come to the point of understanding their relationship and their family and their attachment in order to move through what they need to get to take care of themselves as they work through their illnesses. Forgiveness may be one of the most powerful gifts we can give ourselves and others. There are many wisdom traditions that speak of forgiveness. The notion is that through forgiveness, we recognize our faults, our regrets, and we understand that we have to heal these hurts. And in order to do so, we must allow for all the reactions to take place. This becomes an even more crucial step as you begin to have those conversations. Please forgive me and I forgive you may not be easy conversations or phrases to even have or speak in our families. Again, each family is so different. We don't even know that maybe these are phrases that we have been able to say in the past or that they come easily. Thank you, another phrase that Dr. Byock talks about. He quotes Meister Eckhart, a 14th century Christian theologian and mystic, who says, if the only prayer you say in your whole life is thank you, that would suffice. So practicing gratitude daily can have a profound effect on our lives. In the midst of our problems, we can find some joys. In the midst of all of the difficult conversations and the difficult caregiving issues, we can say thank you. And it starts off with little thank yous that sometimes we don't always remember to say. And finally, he talks about the phrase, I love you. What keeps us alive, what allows us to endure? I think it is the hope of loving or being loved. Sometimes we assume that our family members know that we love them. Parents sometimes assume since we're providing for our children, they understand we love them. Spouses might assume that since we're taking care of business, the cooking, the cleaning, the providing for the financial house, that means I love you. But we do need to hear these words. And we do need to hear the words in the midst of all of the other things that we're doing in finding out what the symptoms are with developing care teams. It's easy to forget saying, I love you. So So Dr. Byrock encourages us to say these daily and to say them as a matter of course, not because we're ill or because we are now dealing with this progressive illness, but to use them as a daily thing before we get to the point where we have a limited amount of time. The most loving and caring task we can offer our loved ones is to ask, what are your wishes as your illness changes? What have I gained and what have I lost? To name something is very powerful. So when we name what it is that we have, when we have a name for our illness, this can be overwhelming, but it can also be a relief to finally know what it is that's happening to us. It can also bring some deep sorrow. It can also elicit some fear. Oftentimes these reactions may be negative, but they can also be a positive. My mother was 59 years old when she died. At 55, she was diagnosed with breast cancer. And the biggest part for her was that her entire life changed. Her physical health changed. Her independence changed. Her ability to make decisions changed. She had dreams and she had hopes, things that she wanted to accomplish. She was not yet finished and wanted to do a lot more. But when I asked her what could she have gained from this diagnosis and from this prognosis, she said she gained the opportunity to have her children around her. As a family, we had drifted apart as she and my father built new families after their divorce. But she was able to say, please, I need you. She was able to say, forgive me. And she was able to say, thank you. We started the conversations. We started talking and shouting and yelling and listening and planning. She needed the care of my brothers and myself. And so for 2 years, we offered that care for her through that time and at the time of her death. She wasn't able to really speak and say what it was that she wanted very clearly. So we gave her a legal pad and a pen, and we asked her to write down all the things that she wanted, all the things that she needed to have done. So we started making plans. We started asking her, when we're not here, who will care for you? And it's very important to reach out and to utilize the resources you have in your medical team, the social workers, the chaplains, the nurses, all of those technicians that will help. They do have the information about what sitter services are available, what home health care services are available. And then it's also good to ask each other, those members of our family, who's going to be here? And it's really important in all of that planning and question and asking is, am I able to do this? Am I able to be here? And at what cost? The costs are not just the healthcare costs and the insurance policy costs and those things. The costs are our time and our energy. And how can we, together as a team, as a family, make sure that the wishes are met? So how do we know? Well, we start with some advanced directives, and that means a living will. If I'm not able to say what it is that I need, who's going to do that for me? And the most loving piece of all of this in our family was that we were able to carry out my mother's wishes on what the things that she needed and wanted. Now, mind you, they were not my decisions, and I would not have chosen some of the things that she chose. They were hers. And the hardest part, I believe, as an adult child in taking care of your parent is to understand that they have their own wishes. And while they're not ours, we can still, in a loving way, make them so. So who's the power of attorney? Who is the general power of attorney? Where are all those pieces of information that we need to know for when our loved one is no longer able to say? And when is it going to be time for hospice? These are very difficult conversations to have, obviously. So what do I want? What are my wishes? Who will care for me? Those are the questions as a patient you might want to ask. When do I want to call hospice? Because when I want to call hospice as an adult child may not be when my parent wants me to call hospice. So we have to keep that open mind. We have to be able to understand that these are really important questions and are difficult to answer. We need to take time with each other. We need to make certain and know that in the middle of all of this, we will have a difficult time, and that it's okay for all of that yelling, for all of the concerns, for all of the things that may not work out in our time frame. One of the things that I looked at when I was putting some of this together was a guide for people living with PSP, and on the website. And I think it's also really important to make sure that we have affirmations, if you will, and to remember to keep an open mind and an open heart. So some of these affirmations, as you see, is that thou shalt love thyself as thy neighbor, because we have to start with us first to be able to understand what our needs are, to be able to then tell those folks in our family and our physicians, what do I want to do? Thou shalt take thine own advice. It's real easy to give advice, and sometimes it's not always easy to hear what other folks are saying. And I think taking ridiculous risks in this context means being able to ask for help. It's very difficult in watching my mother struggle as her independence diminished. It was very difficult for her to ask for all of us to help her with the most basic of needs. At one point in time, we were able to let her know that she did this for us at one point, so now we were giving that back to her. And with that loving knowledge, she was able to ask for things, help and assistance before she took risks that might have put her in even more danger, put her health in danger. So I don't want to read all of the things on the list, but just to kind of pull out a few. I think it's really important to take those breaks, to know that that taking the breaks will help in the long run. And I think it's really important, although hard, to know when thy warranty is up, meaning when it's time to call hospice, when it's time to stop treatment, when it's time to do all those things. All of us are very unique and different, and so it just depends on who we are and what we're up against as to when this will be that time. And one of the biggest pieces, I think, also is cultivating a sense of humor. It's very important to find what those coping mechanisms are for us and what works for us, what helps us through this process. So that's my presentation. I will leave it open for questions.
All right, thank you, Valerie. So at this point, we're going to accept some questions. You'll see that your screen has changed a little bit. At the bottom of your screen, there is a white box where you can type in any questions you may have for Valerie. So go ahead and do that at this time, and we will field the questions as they come in.
I see Ben says, what if the patient...
Yeah, I think it's just an incomplete question. But go ahead and type those questions in, and we will field them as we can. That's a good question. What if the patient has no interest in these type of conversations? Do you force the issue? Do you leave it alone? Yeah, how would you proceed with that?
I think it's really important to understand what these types of questions, you know what they are for you. And if the patient or the person that you're caring for has no interest in the questions, you can't change their mind. You can't change their mind, but you can still do what you need to do. You can still say the I thank yous, still say I love you, still have that conversation, talk about, when I am taking care of you, sometimes I wonder if this is enough. You may not get an answer, but they hear the question still.
And what if the person is in denial? What if they don't believe that it's happening? They don't want to talk about it. It's a very, very negative thing for them. How would you approach that?
Well, I think that it's fun. Denial is a funny thing to me. I very rarely see people who are in complete denial, like they really do not know what is happening. I think more people are in, rather than denial, in avoidance. We avoid that because it is frightening, because it is fearful, because we don't have an answer to the question, what's going to happen to me? So I think it's okay to say things like, I know you don't want to talk about this right now, but I'm just telling you right now I feel like whatever it is, and say it. I guess the idea here is not to expect that there's an answer. My mother would not discuss her pain medication. She did not want to take pain medication because she felt as though this was a punishment. It was a punishment for not getting treatment sooner. It was a punishment for things that she had done in her life. And I finally said, well, I don't know about that, but can you please put me out of my misery because it's too hard to watch you in pain. That was okay for her. I think it's a matter of continuing to have that conversation even though you may not get any response. And then again, sometimes we have those conversations to ourselves and with ourselves.
So another question we have here, the four phases that you mentioned, forgive me, forgive you, thank you, and I love you, those come from the love poems of God, perhaps?
This comes from Ira Byrok, who's a physician, and he wrote in a book, The Four Things That Matter Most. And so that's what he was saying, was that in all of his work, he found that the four things that mattered most to people who were struggling with chronic illness and with end-of-life issues were their relationships. And sometimes those relationships had struggled over the years. So the four things that matter most, the four phrases, were to say, please forgive me, I forgive you, I love you, and thank you. And that might be the beginning of those conversations.
Another question here is, my biggest concern is, although I have already done the living will, and I ask my husband what he wants, and I include him in all the conversations about his care and what doctors say, but what happens when he can no longer talk, and without normal eye movement, how will I be able to communicate with him? Maybe I can tackle this one.
Yes.
Oftentimes in PSP, people have this issue, and they devise ways around it. If you're not able to look at the person, you're not able to talk with him, he's not able to talk with you. There are things that you can get. There are pieces of equipment. There are software applications where he can still be able to communicate with you through writing or through some sort of interface that you can get. Sometimes people keep it really simple and they say, they'll hold his hand and say, and ask him simple questions, yes, no questions. How are you feeling? Is there something that I can help you with? Yes or no. If yes, squeeze my hand twice. If no, don't squeeze my hand. So there are certain things that you can do to get around not being able to speak to someone directly. I hope that answers your question. Looks like we have another one here. Is there a time when including the doctor into this type of conversation is important? At what point do you bring in the doctor to try and maybe convince the patient?
Well, I think anytime you go to the physician and you have those appointments, I think those are conversations you have all the way through. Every time you go is, I'm having a difficult time getting my father, or I'm having a difficult time getting my husband to understand that I need to do this in order to take better care of him, and we seem to struggle. and I want to do, so the conversation you're having is with the physician, but your loved one is in the room, so they hear it. And so it's kind of a circular conversation, but they do hear it. And then the physician answers your question and they do hear it. It's a funny way to do that in some ways, and it may not be as directly as we want it to be, but I think that the point is that the communication is happening. The conversation might be through you and the physician with your loved one there, but they still hear what that is.
So Valerie, as you may know, in with these diseases, PSP, CBD, MSA, um, it's there is no cure right now. So if the person is holding on to an unrealistic hope that they will be cured, is it okay to push the need for these difficult questions? Essentially, they would still be in denial.
I don't know, every relationship and every family is unique. And so when you are able to say, I'm really struggling with this and I need to have this question answered. At some point in time, I think as caregivers, we have to make sure that the person is safe, that they get what they need. Um, Denial or avoidance or all those things will happen no matter what. We have to be able to go around that and still, I don't know that I would push the conversation, but I would bring it up in ways. You can bring it up in humorous ways. You can bring it up when maybe someone makes a comment at a family gathering, or maybe something you've seen in a movie. Wow, that's really interesting. That reminds me of how I'm struggling. At some point in time, we make the decisions because they have to be made. Um, I hope that's a
Um,
good, yeah.
yeah. As a practical matter, if the avoidant patient will not express their desires and a living will has not been established, does or will the caregiver eventually have to make the decisions for the patient when and if they are no longer able to express their desires?
When they're no longer able to express those, then yes, we do that. It's really important then to make sure that at the very least someone is asked, when you're no longer able to make these decisions, do you want me to be your medical power of attorney so I can make decisions for you? That's a yes or no. Now, you may not be able to say the specifics of what those decisions are, but at least you know that you have the blessing, if you will, of that patient to say, yes, you can make those decisions for me.
I see we have another question about the slides being available. Valerie, I assume you will allow for the slides to be made available
Yes,
on our website
yes,
after
yes,
the fact. Okay, so those will be up there along with a recording of this webinar for
yes.
those that were curious. If you
Mhm.
have any other questions, go ahead and type them into the box at the bottom of your screen right now, and we will try and answer them. Valerie, would you be
Yeah.
willing to share your contact information for people who may have longer
Sure,
questions than
most definitely. Yes,
are possible right now?
yes.
Okay. If you'd like to get in touch with Valerie, go ahead and send me an email. My email is Janelle, Janele, at CurePSP.org. And I will send those questions on to Valerie, and she'll be able to answer them. That's my email is Janelle, Janele, at CurePSP.org. Let's see, we have another question here. What do you do when a patient wants to keep looking for new doctors? I assume to get a different answer. Um,
Kind of like a second opinion.
Yes.
And a third and a fourth.
Yeah, maybe I'll tackle this one. We always encourage uh, anyone who potentially has PSP or a similar disease to get a second opinion, to get a third opinion, to get a fourth opinion. You want to be sure. Again, with PSP and those types of diseases, misdiagnosis is so incredibly common. So many people get diagnosed as Parkinson's disease, as Alzheimer's, as ALS, and so it's very important to make sure that you have that diagnosis because it may not be PSP at all, or it could be the complete opposite. So yes, you definitely want to get a second opinion if the patient is looking to do that. What was the saying when you learn you have an illness? Loss of the heart, but gain of the spirit. What was that phrase,
Oh, what
Valerie?
was it? It was a here. Let me find that for you. It was a Sufi prophet that said, um, it's a proverb. When the heart weeps for what it has lost, the spirit laughs for what it has found. Kind of like we know that on some level, this disease, this struggle that we're having is so full of sorrow. But within that, we can also find um, opportunities to heal relationships. I think the biggest opportunity that my family found was that we all came back together. And so while there wasn't any healing of a cancer, and there was no healing, in fact, the treatment was worse than the disease itself, what we were able to do was find the spirit of our family again, coming together, creating relationships, making sure that grandchildren and great-grandchildren, we had a connection, and we knew who my mom was to all of us. And I think that's the point of that proverb. When the heart weeps for what it has lost, the spirit laughs for what it has found. There's joy in our sorrow.
Valerie, could you just repeat that proverb one more time?
When the heart weeps for what it has lost, the spirit laughs for what is found.
Okay, so I have another question here. If the spouse or family of the patient refuses to allow an aide or maybe an extra caregiver for the patient because it will make the patient feel useless, how would you deal with that kind of a difficult conversation?
I think I would, that might be the time when you get your other team involved. In other words, other family members, your physician, your medical team, your social worker, even your pastor, your minister, your rabbi. It might be something bigger than just you and that person, because there's a whole lot going on here. It's not just I'm taking care of and I need help. It also happens to be what it makes me feel like when I feel useless. I'm feeling useless or helpless. And so there's a loss there. And so as long as there's no one else helping me, then that loss isn't as real. And so that is, if you will, one of those spiritual reactions in a way. It has to do with the meaning of my life and what I am and my role in this family. And so I would invite getting other folks on your team, if you will, to help with that conversation. And also, I've had some family members that have said, the doctor says I can no longer take care of you because my back is not going to manage it. There are other ways to get around that. But I think I would start with getting as many people helping with that conversation as you can.
Okay, well, I don't see any other questions, so I think we're going to wrap it up here.
Great.
Valerie, thank you very much for this wonderful webinar.
Thank you.
It's going to it's going to be great for all the people who can come back and watch it on their own time who may not have been able to make it. I also want to thank everyone who was able to make it. We had a very large attendance today, so thank you all for coming. Remember, the slides and a recording of this webinar will be posted on our website starting about tomorrow. So look for that if you'd like to pass it along to someone that you care about. All right. Well, thank you so much, everyone. Have a great day.
Thank you.